Hi everyone. I thought I would come on and give you a bit of an update. I did say I would a few days ago, but life got busy and I didn't get time. Um, I've had a few comments left on some of my videos and a few questions that I thought I would try and answer today. So one was that the sound quality wasn't very good on my videos, so I do apologise. I am recording these myself on my phone. I don't have any flash equipment or anything like that. It's purely just me recording my experiences on my phone and then posting them for you. So I want to answer a few of the questions that I've had. So one is a lady who is about to go through a very similar experience to me. So if you recall, I have been through the process of having all of my upper teeth removed, which was completed about 2 weeks ago now, just over 2 weeks ago. I had that done in 2 stages. So I had 7 back molars removed first. I then had a period of 4 weeks with no back teeth, which was an experience in itself, before then having my final 5 front teeth removed 2 weeks ago and my temporary denture put in place, which is that one. So all in all, after 2 weeks of having my denture in, things are going pretty okay. There are some ups and some downs, if I'm being honest. So first week is quite difficult. You are not only putting up with pain from your extraction sites, which does go after a couple of days, but you are still tender and you are still wearing something that's quite foreign in your mouth. So it's not easy, and I wouldn't want to lie to anyone by saying that it is easy. It's not. Having a denture in for the first time is psychologically challenging, and it's also quite a significant life change. So I think you need to prepare yourself, and the best way for me that worked was to do as much research on dentures as I possibly could. I watched every available video that I could find on YouTube. I read up, I did dental blogs, anything where I could get some information about how the procedure was going to happen, how it was going to feel after it was done, and how do you live after having a denture put in, because it is quite significant. So yes, the first week is hard because you have a sore mouth where you've had your extractions done, but with adequate pain relief and anti-inflammatory medication, that should keep it under control. The second thing is you have a foreign body in your mouth for the first time that you're not used to. So your denture has quite a significant plate on the roof of your mouth. Now that does take a bit of getting used to, and to be honest, I have moments where I forget it's there after 2 weeks, but most of the time I am very aware that it's there. You over salivate because you have something in your mouth, so your body is adjusting to getting used to having this plate in your mouth. That takes a bit of getting used to, and so you find you'll stop and you'll pause when you're talking and you'll swallow because you are over salivating. But that does lessen as well. So after 2 weeks, I'm talking much better. I do whistle sometimes and I do lisp a bit now because They're not the same as your teeth wear. They feel very different. The heights of them are very different on the back. So your tongue actually tends to overlap. Well, mine do anyway. I think it probably is different for everybody, but for me, my tongue still overlaps my back teeth because they seem to be shorter at the back than they are at the front. But they're comfortable at the moment. I haven't noticed any significant changes in how they're fitting. So after 2 weeks, I think you'll find that you will be adjusting, the pain will be gone, your extraction sites will be on their way to healing, depending on how many teeth you've had removed. And you'll be thinking about things like fixing creams, cushion grips, anything that is going to make your denture stay in securely, because that was my biggest fear, was my denture falling out on my dinner plate or sneezing and my denture flying across the room. Thankfully that hasn't happened. So yeah, give yourself time, be patient, be kind to yourself, because it is a big transition. It takes time. So one of the other questions I had was about, how do I feel about looking at myself in the mirror now with no teeth? So the first time it was a bit of a shock. In fact, the first time I took my dentures out, because after having my extractions done, I had to keep my denture in for 48 hours. And after that, I could remove them and clean them for a couple of hours and then put them back in. And that first time I took them out, I actually didn't look. And I went about my business without my teeth in, with no one around. I had a coffee, and then I went back up after a couple of hours and I put them back in again without looking. So I would say you have to prepare yourself for that. The second time I took them out, I did look. And to be honest, it wasn't as bad as you would think. It is strange to look at yourself with no teeth. The biggest thing that I noticed is how you talk with no teeth in. So your lips tend to fold in a bit, and your bottom lip seems to come up higher because there's nothing for it to kind of hit against to stop that. But I kind of resigned myself to the fact that I've got no upper teeth, and there's nothing you can do about it. They've gone. Once they're gone, they're gone. They're not coming back. So you have to get used to it. I don't show anybody what I look like without my teeth. I don't want anybody to see me without my teeth. Not even, I mean, I live with my daughter. I don't even show her what I look like with no teeth. I get up in the morning, I sort my dogs out, I come back upstairs, I brush my lower teeth because they're still mine, and I clean the roof of my mouth, and I use a soft toothbrush over my extraction sites and over my gums at the top, and then I rinse and clean my denture, and I do clean the teeth, the actual acrylic teeth, with a bit of toothpaste, and I then add in my fixing cream. So I'm using Fixodent. So just 3 small dabs of that, one in each corner and one at the front of your denture. And I've found that that holds my denture all day. I haven't had to reapply it. I notice at about 7 o'clock at night, after having had my dentures in all day, I can start to move them about. So I can start to loosen them off, which has become a bit of a habit now. I rock them from side to side. So staying in wise feels much, much better. The other thing is eating. So can you eat? The first week, I would say it's very hard. They're not your normal teeth. You can't chew like you used to chew. So you have to learn and adapt to eat again with plastic teeth, basically. The first week of having them in, I ate soft foods. I ate pasta, soups, yogurts, anything that I didn't have to chew a lot. You can't chew in a rounded way like you would have before. So you begin to learn to chew by literally going up and down rather than up, down and around like you would have. So yeah, it takes a bit of getting used to, but I'm now week 2 and I am eating pretty normal food now, I would say. So there is light at the end of the tunnel. I can now eat pastry. I can eat just pretty normal stuff. I had a chicken pie and potatoes the other night and I ate them with no problem whatsoever. And this morning I have eaten a bowl of granola, which you know you have to chew quite a lot, with yogurt. And I'm now eating that with no problem at all. So you can do it and you will do it because ultimately you have to do it because you've got new teeth and you have to learn how to use them. So I actually feel much more positive now with mine. I know that, you know, over the coming weeks and months, they're going to start to get loose. And that's why I bought something called cushion grip. So you can actually use that kind of like a liner in your denture. So it forms, it's a paste that you apply to your denture and you cover the whole denture with that. It stays in place even when you soak it for about 4 days. And then you have to peel it off, clean your denture thoroughly and then reapply it. It softens the denture. So if you have got tender spots or it does help to ease that a little bit, and you can still use your fixing cream on top of the cushion grip. Not sure if it works as effectively. I've only tried the cushion grip once so far because actually I don't need it at the moment. My dentures don't hurt. They're sitting comfortably. I've got no sore spots in my mouth. I've had one adjustment done and that was during the first week of having the denture. Week 2 I haven't needed any further adjustments so far, but I'm sure further down the line I probably will. I go to work full time, and I think again, if I'm being realistic, that first week of having your denture, if you can stay at home, because you're going to be a bit sore and you're not going to be able to talk properly and you can't eat properly, so it's actually a safer place to be at home. I actually took a week off sick because I needed time psychologically to adjust and physically to adjust and to let my dentures, you know, get used to wearing a prosthetic denture in my mouth. And I think now week 2 I actually feel a lot more confident. I'm back at work. I can talk and hold my meetings. I can eat. You know, I'll have my granola in the morning, like I said. I'll eat some grapes during the day. I'll have my soup at lunch. And then I will come home and I will eat a normal dinner. No one needs to know, really. And, you know, the comments I've had about mine is that if you didn't tell anybody, they wouldn't know. So unless you're pointing it out to them, look, I've got dentures, you know, people aren't gonna notice. That's part of the reason for my colour choice of my denture. So I wanted my dentures to match my bottom teeth because I wasn't having my bottom teeth removed. So they pretty much match. My bottom ones need cleaning, which is going to happen in a couple of weeks, but pretty much they're a match. Now, if I'd gone for sparkly white dentures, they would have looked odd and they would have stood out. And so I'm very grateful to my dentist for actually giving me the advice that, you know, match them to your bottom teeth, because people won't know then that you're wearing a denture unless you're having both sets done. If you're having top and bottom, then go for it. Have the whitest of white teeth you possibly would want. But for me at the moment, that's not realistic, and I don't want to stand out. I think that's the important thing. I want to help people to understand that it's not the end of the world, and that you can survive once you've had dentures put in. That yes, it's a big life adjustment, but you will get there. So yeah, so all in all, don't worry about taking your dentures out. It only has to be you, you know, that sees you with no dentures. I mean, I'm not married, so you know, I don't have to show my partner what I look like with no teeth. I can have that privacy, and I know that's slightly more difficult if you're in a relationship or you're married. You know, but it doesn't change your whole face by taking your denture out. It just changes how you look when you try and talk, I think, and you lose a bit of your facial structure. So you will tend to go in a bit here when you take your teeth out. I noticed it when I had my back teeth out. I had quite a big indent in both sides of my face. But with my teeth in, I don't have that. So, you know, if you're married and you've been with somebody for a long time, they are not going to judge you for not having teeth. It's not the end of the world. And as long as, you know, you've got your teeth in public, and who's going to know and who's going to care? So yeah, you will survive it. It's okay. I've got a few months to go now. Well, I've got until August before I can have a permanent denture made and fitted. I am researching that at the moment. There's lots of things out there, digital dentures now, 3D scanning, all of those things. So it's worth doing your research is what I would say. But give yourself time and be fair and be realistic that you're not going to come home and eat a 3-course meal after having tooth extractions and a hunk of plastic put in your mouth. You're not. But after a week or 2 weeks, you will be able to go out and eat in public. I think the Fixodent fixing cream has really helped me. It's made me feel more secure. So if you're worried about that, then put a little bit of fixing cream in. You know, there are pros and cons to fixing cream. As I've said in a previous video, you do have to scrape that stuff out of your mouth in the evening, but I've developed a bit of a knack for that now. So as my dentures start loosening off in the evening, around 7 o'clock, and I rock them back and forth and I push them forward, it loosens off the Fixodent. So actually when I go to take them out and clean them, there's only a little bit left on the roof of my mouth because I've actually rocked my denture around quite a lot to loosen it off. So that's worked much better because the cream is not very nice. So I hope I've answered your questions, but by all means, please do message me with any questions. I'm not an expert. I am not, you know, being funded to make videos. I am purely doing this to, one, catalogue my own experience of what I've been through, and also to support other people who are doing their research before going through this, because I found that really, really helpful. So please do send me questions. If I can help, I will help. If I don't know, I will tell you, or I'll find out, and I'll update you. So nice to talk to you again, and I'll see you all again soon.